You know what that means. It's time now for Explain and Verify. And today we're looking at the alcohol industry, the positive impact as well as the negative consequences of high alcohol consumption in South Africa. According to the World Health Organization, alcohol is responsible for about 3 million premature deaths worldwide. In South Africa, it accounts for approximately 62,000 premature deaths annually, with 60% of those deaths occurring in people in the low and 15% in the high SCS groups. Does South Africa have an alcohol problem, or is it a discipline problem? For our Explain and Verify feature, we're now joined by SABC News researcher Velemseni Mthiyane, who is joining us to talk about this. So, Veli, do we have an alcohol problem?
Well, let the facts speak for themselves. Interestingly, only a third of South African adults consume alcohol. However, alcohol consumption among drinkers and the prevalence of binge drinking is very high. Needless to say, high alcohol consumption contributes to a large number of health diseases, domestic and gender-based violence, homicide, road fatalities, and billions of rands spent on insurance claims as well as public health costs. Let's have a look at alcohol consumption levels in the country. Now, if we look, Bongiwe, in terms of how our country is consuming alcohol, so we are the fifth highest consumption. We have the fifth highest consumption rate in the world. That's according to World Health Organization. This is at the back of what I've just mentioned, that only just a fraction of those who are adults actually consume alcohol, but it means the quantities which they consume is very high, which places us at the fifth position in terms of the highest consumption rate of alcohol in the world. And again, when we look at the average alcohol consumer in the country, on average per consumer, it's about 30 liters per annum, per person. Now, that's quite a lot if you look at in terms of the population. So that's quite a huge a number. And again, if we look in terms of who is drinking, we know that in South Africa, the official age where you can even be allowed to buy alcohol is about 18 years. But now we know that 31% of people aged 15 and above do drink. So there is an indication of an underage alcohol consumption in the country. But now also, if we look at 59% of those who are drinking, they are said to be binge drinkers. So this is another problem that we are having. So there's a high level of alcohol abuse. Then the question is alcohol good or not? Then the question is, you have asked me, is it a discipline problem or is it an alcohol problem? It does appear that it is a discipline problem. Then 26% of alcohol is homemade. 26% of alcohol found in this country is homemade or illegally produced. Very interesting figure right there. And about 60,000 licensed alcohol outlets, and of which there's about 12,000 of them which are not licensed. So if we look at the next graphic, it will tell us in terms of what type of alcohol is consumed in South Africa. South Africa is a beer drinking nation, because this is what the statistics is telling us. If we look at this pie chart, we can see that beer is at 70% in terms of consumption. So in all the alcohol that is consumed in South Africa, 70% of that is beer. And then of course we're moving into the other categories, but by and large we are consuming largely beer. Not everyone drinks, a fraction of the population is drinking, but what they are drinking is actually in huge quantities.
Very worrying statistics, Vele, especially when you look at just how, they reveal uncomfortable facts about alcohol consumption in South Africa, as well as illicit alcohol, trade, as well as underage drinking, which for me is one of the biggest concerns, and other social ills. So do we know, though, how much of this irresponsible drinking contributes to what we see happening on our roads, especially when it comes to accidents and fatalities?
Sure. According to Arrive Alive campaign, drinking and driving is one of the biggest threats to road safety in South Africa. The research that they conducted indicates that about 50% of the people who die on the roads are found to have at least a high level of alcohol consumption. That could be the drivers or the pedestrians or even sometimes the passengers.
And are there sufficient interventions that are being put in place to deal with this?
Sure. Again, let's bring an expert into this conversation. Adila Dedricks, she is Secretary General of the Southern African Alcohol Policy Alliance. Good evening. How are you?
Good evening, and thank you for having us. How are you?
Well, I'm good. We are good. We are good. We are looking at the issue of the alcohol consumption in the country. Alcohol, the liquor industry is undoubtedly one of the biggest and most profitable businesses in South Africa, and it employs close to 500,000 people, and it also contributes about 2 to 3% to South Africa's GDP. However, are all the stakeholders doing enough to address the problem of alcohol abuse?
Well, thank you. I mean, I think the background you sketched earlier on clearly indicates that we've got a problem. And when the question comes, is it a discipline problem? We would say that it's actually a problem of availability, pricing, and marketing. The figures that you quoted around availability is unfortunately a bit outdated. We have a problem of a very high level of availability within communities where people live. So, for instance, in Khayelitsha in Cape Town, in a study, it found that there was over 1,000 outlets within Khayelitsha, and of which only 11% is licensed. And that people lived within 3 to 5 minutes walking distance of the nearest alcohol outlet. So the problem is that we have alcohol readily available to communities, and the availability normalizes its presence and makes people think that it is okay to drink. In the absence of other social recreational activities and facilities, alcohol outlets therefore becomes a place that many people go to. In addition to that, we found that the price of alcohol is a problem in South Africa, that Cape Town and Johannesburg has been found to be amongst the top 5 cities in the world for having the cheapest alcohol and specifically beer available. So when you say South Africans are beer drinkers, that's because our beer is very cheap. And so it makes it an obvious choice for people that are consuming alcohol. And then on top of that, we've got a problem of marketing. Our marketing is not regulated. I think people that work in the media industry would see this, where you have alcohol adverts on television during prime time. That again contributes to normalizing it. And then, of course, we have to acknowledge that one of our problems in South Africa is that we have very limited enforcement of the law. Our police knows what the problem is. They know where the unlicensed outlets are, but nothing is being done about it.
Sure.
I think the issue that the Johannesburg, the Gauteng, and the Limpopo governments did over the festive season is already an indication, however, that government is understanding that there's a problem. When they said that outlets must close at 6 p.m. in Hillbrow, this is because they have historically had problems with people on New Year's Eve being drunk and therefore having great incidences of violence. Sure. Similarly, in Limpopo, when they enforced the midnight law, it's because they understand and they carry the burden of the high consumption of those minority of people that is consuming alcohol.
Sure. Well, we have just touched on the third question that I had prepared in terms of density of alcohol in communities. So you are saying the problem essentially here is that there is too much outlets, so it's alcohol density in the communities, which is a problem. Number two, you are saying is the issue of pricing. You are even saying that South Africa, or should I say Cape Town and Johannesburg, rates among those cities with the cheapest alcohol, particularly beer. That's what we are saying.
Absolutely. And so when you look at the issue of density, our problem is that we have, and some of that is historical, but part of it is that historical pattern has been perpetuated, where you have alcohol outlets in communities where people live. So in residential areas like Halicha, like Soweto, you would have it, but you won't have it in Houghton, you won't have it in Sandton, you won't have it in Claremont or Bishop's Court, across in areas where the more affluent people are living. And what's happening is that our liquor license authorities continues to issue licenses to outlets in communities where the majority of people live. Sure. And they're not taking into consideration the issue of density. We've just recently undertaken a feasibility study where we looked at the relationship between alcohol availability and GBV in two communities in South Africa, in Ga-Rankuwa, in Thembalethu. And what we found was that there was such a high number of outlets in both those communities, and that the police statistics on reported GBV and crime stats basically showed that there was a relationship between where the alcohol outlets were and the reported cases of GBV in the different pockets within those communities. So one of the issues that we would want to bring to the table is that government needs to take responsibility for changing the environment in which people live and where alcohol is available. Sure. That we should not be issuing more liquor licenses in communities where people live. If we just go back to what happened in Enyobeni
in a minute
in 2022, where we had all those children that died, and it was in a community where people lived, where the community had reported that there's a problem with how the liquor outlet was trading, and the police and the liquor authority did not act on it. So the question is, what is government doing to change the environment in which alcohol is available within communities where the majority of people live?
Well, Adila, thank you so much. Bongiwe, as you have heard from Adila, the problem is bigger than what we have just said. They are saying actually about 11% compliance in terms of outlets that are selling alcohol in some of the densely populated areas in this country. Another problem is that our alcohol apparently is one of the cheapest, is among the cheapest in the world, and particularly beer. As we have said, the statistics have revealed about 71% of alcohol consumed in South Africa is actually beer.
And do we know, though, just how much of alcohol is also consumed through illicit trade?
Sure. It seems the illicit trade of alcohol beverages is a serious challenge requiring greater and concerted attention to curb both its supply and demand. So now, the challenge that we are having is that the country in South Africa, as we speak, is as Adila has mentioned, is the issue of enforcement. So a number of studies have been conducted in South Africa to quantify the problem, with estimates which said the illicit market ranges between 14 and 22% of the alcohol that is found in the country. So illicit trade in alcohol beverages can take the form of counterfeits, which is illicit branded and unbranded alcohol, smuggled products, as well as some industrial spirits which people they make at their own homes. Now, if you beg your pardon, in some factories where they illegally produce some of these spirits, so it means they are not paying tax. They're also making the availability of alcohol higher than what Adila has just mentioned, that despite that the official numbers of alcohol available is actually high, it means that the illicit alcohol trade makes it even more available, which causes a problem in the country.
Do we know if there are any positives at all when it comes to this industry?
Sure. If we are to look, the Drinks Federation of South Africa commissioned a probe into economic impact of South Africa's alcohol beverage industry. The probe was conducted by a research organization called Quantec last year, which is 2024, using the 2022 data. It was titled "The Contribution of the Alcohol Beverage Industry to the Economy of South Africa." This is what it found. So the next graphic is going to tell us that if we look in terms of the economic impact, there is, we must state this, that the alcohol industry contributes about 2 to 3% to GDP, the country's GDP. That's quite a huge number, and it supports a large number of employment. So in 2022, it contributed about 226.3 billion rands into South Africa's economy. And in terms of VAT and other customs, it contributed about 28.4 billion rands. But when it comes to as I've already mentioned, I think it's 3.6% in terms of the latest figures, 3.6% contribution to the GDP. And then when it comes to excise tax contributions, it's about 47.9% that comes from the alcohol. So the next graphic is going to tell us again the further benefits. So if we look into about the total economic contribution in terms of the value chain, it's about 482.7 billion. That's according to the statistics which was found last year, but using the data of 2022. And then the total government tax revenue that the alcohol industry contributes is about 6.7%. And then the total tax contribution is about 96.9 billion bongiwe.
And when you look then at, especially the economic impact, jobs as well, how are we looking?
Well, the next graphic is going to show us in terms of, so 1 in 31 jobs in South Africa comes from this sector. So it is very critical when it comes to employment. And again, 498,999, that's a number of jobs that are supported by the alcohol industry in the country. And then with that, about 1.1 million people are supported in the country through the incomes that are earned by those who are employed in the alcohol industry.
Quite interesting.
So again, Bongo, I must mention that South Africa is a net exporter of liquor, primarily due to its extensive wine exports. In 2022, total alcohol beverage exports reached 20.6 billion rands, of which 55% was wine, while liquor imports reached around 9 billion. So we are net exporter.
Okay. I don't know. I'm just not sure. Looking at the numbers, quite an interesting conversation needs to be had about this issue of alcohol. But Vele, thank you so much for that. I mean, there are different sentiments, for example, regarding the industry. When one considers both the positive and the negative impacts, more needs to be done, though, to ensure that the negative impact of alcohol is further reduced, as findings by the South African Medical Research Council revealed that men who abuse alcohol are 3 times more likely to commit gender-based violence or interpersonal violence. Women whose partners are regularly intoxicated are almost likely 6 times to more likely experience GBV or IPV. The density of alcohol outlets in a community increases also the risks of gender-based violence. Alcohol also poses a major burden on healthcare as well as emergency services. So certainly mixed reaction to alcohol and the problem in South Africa. But the issue of underage drinking is one that we have not even begun to discuss in greater detail. But thank you so much to Velemseni Mthiyane there with the research and looking at this issue of alcohol consumption in the country.